Good afternoon, everyone. My name is Abubakar Mamman, that is Nurse Pashkar. I'm here to perform a procedure on proper hand washing. Proper hand washing is part of personal hygiene. As a healthcare provider, you must always take care of washing hands before and after any procedure. Before and after any procedure, before eating and after eating, and whatsoever you do when you touch a patient is a right time for you to perform hand hygiene before you touch a patient. After touching a patient, you are expected to perform hand hygiene before you touch another patient. And any other nurses procedure you carry out or any healthcare procedure you carry out, you are expected to carry out hand washing. Proper hand washing, it is done in several steps. I can make it possible in 7 steps. Now, 7 steps on performing hand hygiene. This is what you are expected to have. Number 1, you are expected to have a sink where you perform the hand washing. You understand? And you are expected to have a liquid soap where you are expected to use liquid soap. And we are, as you can see, we also have our towel and we have our planners. Now, in performing hand hygiene, you have to follow it this way. Now, how do you do it? Step 1. So step 1 is on the tap. As you on the tap, first of all, before you on your tap, you have to, that your long sleeve, you have to reduce it. 1. Secondly, after you have done that, then the second thing, you have to remove your wristwatch. Any jewelries, you have to remove them. Then after you've on the tap in step 1, and also I would like to throw more light on the handles. We have different handles, different types of handles. We have hand operator handles, operator control, the one you can use hand to open it. We also have another one. We also have knee lever control. We have the one with knee that you can use your knee to open it. We also have another one that is called infrared hand control. That infrared hand control is also one of the way of opening some water. It's just a sensor. As you come, it will sense. As you draw, as you move back, it will be up. As you come, it will be on. As you move back, it will be off. Then the other one we have elbow control. The one you use elbow to open it. Then after you are done with the hand washing, then you can use your elbow to close it. That one is also elbow control operator. That is 4. We have hand control, we have elbow control, we have knee lever control, or we have infrared, the one that you said. The second step is weight your hands. How do you weight your hands? You must weight your hands from below the arm. You have to weight your hands from below the arm. Then the third step is to apply the liquid soap of about 4 to 5 mils. Expectedly, you are expected to apply 4 to 5 mils. Then the fourth step is to rub the palm of the hands. You have to rub the palm of the hands. Start from, also after that, wash from below the arm, from the lower concentrated area to the higher concentrated area. After you wash, then you interlace your fingers. As you interlace your fingers, then the next thing, wash back of your hands. When you rub the back of your hands, wash the other back of the hands too. Then wash your thumb in circular motion. As you wash your thumb in circular motion, you are also expected to wash the nails. Very, very important for you to wash your nails. Then the next step, step 5, is to rinse your hands. You are expected to do what? To rinse your hands from below the arm. Don't forget, you must rinse your hand from below the arm. After you have done that, then the next step, you are to, off your tap. What do you use to off your tap? That's why you have to use a planners. If you don't have a planners, you can use a towel, a tissue paper. You can use planners, tissue paper. In the absence of tissue paper and planners, you can also pour water on top of the handles like this. Don't use your elbow. Put water on top of the handle to decontaminate the handle, the operator handle. Then you off it. After you have done that, Then the step 7 is to dry your hands. That is step 7, is to dry your hands by the use of towels. You have to dry your hands by the use of towels. That is what? That is the 7th step in performing hand washing. So in the process of drying your hands, in the absence of towel, you can use hand dryer. That is the one from electric dryer. You can use it to dry your hands. In the absence of electric dryer and the towel, you can also use your wall. You can expose your hands to wind so that they can just dry off naturally. That will also is a way of drying your hands. If you are done with that, then you return back your wristwatch, because now you have decontaminated your hands. So after that is when you are expected to go and perform any procedure, 1, or eating, 2, or touching any other patients, as well as touching any other patients folder, nurses station, all other instruments that we are using to perform any procedure on a patient. So when you are done with that, that is all for hand hygiene, which is one of the ways that you perform hand washing, the proper way of performing hand washing. That is how we do it. Yeah, so another way of hands also, you can use hand sanitizer. Anytime you perform any procedure, you can use hand sanitizer. Before you touch a patient's folder, as you touch a patient's folder, definitely, when you touch a patient, your hands are contaminated. As your hands are contaminated, definitely you have to understand that before you touch a patient's folder, you have to use the hand sanitizer. The hand sanitizer to decontaminate your hands. As you decontaminate your hands, definitely even if you touch the folder, it will not infect anybody. When you touch the folder while you do not sanitize your hands, meaning you have contaminated the folder. So any person that will touch the folder will be infected. So please, when we are taking care of all these things, it will also help us to reduce the spread of infection. Now, always when you have to use a patient or touch a patient, you can use hand gloves. We have hand gloves. You can use hand gloves to do what? To touch a patient. Anything you want to do to a patient, you want to get contact with patient's blood, you want to get contact with patient's, patient's body fluids, you want to cannulate a patient, you want to insert catheter, you want to do so many things that are invasive procedures, you have to wear a gloves, which is also part of how to prevent the spread of infection. Most of these communicable diseases are being sprayed due to 1 or 2 of our negligence. So please, let's try as much as we can to reduce the spread of infection to the public, to our patients' relatives, to our patients as well, those that doesn't have 1 or 2 severe diseases, or they don't have any other infectious diseases, they came and they just go home with nosocomial infection. If we can take care of all these things, we can easily prevent the spread of infection. And because infections are easily spread when we are not taking care of all these preventive measures on how to wear masks, how to use gloves, how to sanitize our hands all the time before performing and after performing any procedure to our patients, to our clients in the hospital. And whenever we are trying to do that, we are trying to save the entire public. We are trying to save the entire community. We are trying to save the entire patient's own admission. Thank you so much. I remain Nurse Fashkar from Mr. Fashkar Nurses TV. Thank you so much. Peace out. So any question, please drop it in the comment section, and don't forget to subscribe our channel, Mr. Fashkar Nurses TV. Mr. Fashkar Nurses TV is always with you. Thank you so much. Until we see you next time.